Well, I'm very excited to be here with Noel from Andor. Sonia Singh, Chief Insights Officer of AVIA. We're having a number of these conversations with leaders from both digital health companies and health systems. And today we're very eager to dig into Andor, what is the solution, what it's all about. But let's start with you first, Noel. Tell us a little bit about who's Noel, what's your role, what have you been doing, how long have you been doing this?
I appreciate it, Sonia. First off, just thank you for the opportunity to connect and spend some time with you here today. My way of introduction, my name is Noel Kershakani. I'm the Chief Growth Officer here at Andor Health. I have been with the organization since the very beginning, dating back to 2018, and have had the opportunity to work with our leadership team now for the better part of going on 14 years, believe it or not, with this being our third healthcare technology company together. So
Oh,
it's been a
that's
fun ride.
amazing. That's
Yeah.
amazing.
We
Well, congrats
thank
on the multiple successes.
thank you so much. I think we all share a passion for transformation in healthcare, and we've always believed that some of the more innovative technologies that are out there are giving us opportunities to really change the paradigm. And so we continue to. None of us play golf really well, so we just continue to try to build new technologies and companies out there. So, but today I lead all sales and business development for our organization. We work with now nearly 40 healthcare institutions across the US, the UK, and Canada. So delighted to be here.
That's fantastic. Well, I always like to start with the why, like start with why, right? Like what is the core problem that you saw, that your
Mm,
team saw, and what are you trying to solve? Why is that important? Why is it important now? So tell
yeah.
us a little bit about that first.
Yeah, it's a great question, and it is one thing that drives us every day.
Mm,
Back in late 2018, early 2019, we started to really understand and start to recognize that there were significant burdens that were occurring within clinical staff.
mm,
And why we started to put a focus on that is because the last probably 5, 6, 7 years of what we had done prior was predominantly focused on patient experience and patient engagement and
yeah.
trying to optimize some of those workflows. But in that process, we started to learn that while we are increasing access to care, while we are improving patient experience, we haven't touched the other side of the equation. How do we improve and optimize the workflows of, for
Mm,
example, clinical staff? How do we improve the documentation burdens that occur on clinical staff? And the result of that, I think for us, our why, was that it's no secret that we're seeing shortages in clinical
yeah,
resources
yeah.
upcoming. That's being highlighted significantly over the last year or so. We're seeing a lot of that being driven by burdens that are occurring within this particular space. But there is
Mm,
something interesting that we realized, and that was where we started to see that there was still a lot of manual workflows occurring in collaboration experiences. What we started to realize in 2018, 2019 was that there are all these other technologies that are starting to come out that only focused on, for example, what we call signal identification.
mm,
What's happening with this patient? What's going on with
right,
this
right.
event, right? But that's only one part of the equation. And what ended up happening is we saw an explosion of single purpose technologies, more alert fatigue that would
Yeah.
occur directly to these particular clinical resources. Nobody was really solving the root cause.
Mm,
So we wanted to focus our efforts on really how could we use some of the more innovative AI-based capabilities to actually optimize and make more efficient collaboration workflows for clinical staff to reduce a lot of the cognitive burden that's already on them, but
yeah.
secondarily to give them more of a platform environment that doesn't force them to actually bounce between different technologies that only do one thing.
Yeah. That makes sense. And I think it's so important in the last few years to really focus on easing that clinical burden, nurses, physicians, other frontline staff. So I think you're taking that problem. So tell us now,
Yeah.
what is the solution to address some of that? So we've seen the problem. What is your solution? How are you addressing it?
Well, let's cue in on exactly a statement that you just made, right? Well, what are some of those burdens that we started to
Yeah.
recognize, right? So in the market today, we see everything from AI-based cameras that exist in this space that are helping to identify, for example, patient safety events, falls, so on and so forth. We see, other types of technologies, for example, that are highlighting potential or proactively highlighting potential sepsis events, so on and so forth. Again, from our perspective, that's a signal. What do I do with that particular signal? Who needs to be notified? What context do we need to provide them? What is the documentation or workflow that is required to support that? So when we think about that particular problem, we wanted to bring a platform that actually uses what we call our AI, we call it the Think Andor AI Clinical Copilot. So much like you see today, right, where Microsoft, which we're an M12 portfolio company, we get a chance to work very closely with them, where you have a copilot that kind of tees up very specific administrative events, emails that might need responding to, so on and so forth. Our thought process was, could you actually have a clinical copilot that could use discrete data and discrete information that our AI could actually identify and then raise those events and those particular alerts directly to the right clinical resource and stage the appropriate clinical workflow. But then as part of that, you take it to the next step and actually be able to enable documentation-based capabilities using voice and NLP. So when you take that construct of a clinical copilot, that actually becomes pervasive across all virtual experiences. And so we built a platform, if you will, that allows me to bring all virtual experiences under a single pane of glass. We call a virtual command center that is powered by a clinical copilot to actually identify the event, raise that appropriate event to the right clinical resource or resources, and stage the appropriate clinical workflow and documentation that they can do with the patient just using their voice. Now,
What's an example of like an event that goes through that process?
it's a great question. When you think about that platform, right, we actually kind of liken that to something we call the 5 pillars of virtual health. So that could be traditional virtual visits in an ambulatory setting,
Yeah.
through to the inpatient setting, something we call virtual hospital, where you might do things like virtual nursing, virtual sitting or patient observation, as well as, for example, even on-demand or remote specialty consults. And of course, even extending it into the home with things like remote patient monitoring or transitional care visits. So when we think about that command center, it is understanding what's happening with that patient in context and in their appropriate care environment, and then raising that event to an appropriate resource. Let's break it down to something very specific, virtual nursing, as an example. Patient, for example, could be admitted to the hospital, but according to what we're identifying, for example, from the EHR, is that admission is missing a fall risk, it's missing a medication rec, and it's also missing an allergy reconciliation. So generally, what we've seen in this industry is that oftentimes there is still a lot of burden on the bedside staff to have to walk into the patient's room, have to identify what's happened, hail down someone from a virtual perspective, set up the monitor, so on and so forth. We said, why have the bedside nurse even have to be involved in a situation like that? They need to focus on patient care. So what we do is we let the co-pilot identify that event, raise it to the right virtual nurse that's currently available on shift, assigned to these patients, tee up the actual event, and then allow them to dial in to a camera, for example, that could be sitting in the room. While they're doing that, the co-pilot can actually stage the workflow. So now I can create standardization of exactly what needs to occur, regardless if the virtual nurse has been there 30 years or if they've only been there for 6 months. So that's how we really saw that sort of workflow optimization from a nursing perspective. You take that one more step further, And there was an aha moment for us a few years back where we realized that we should also allow the co-pilot to listen to the conversation between the patient and the nurse. And unlike you typically see with ambient documentation, vendors that are out there who've only focused on physician documentation, we actually said, let's be discreet and focus on nurse-based documentation. So if I need to do a fall risk or an SDOH, or for example, any other type of an assessment, I can have the co-pilot stage that, but then I can have, as I'm in conversation with the patient, it will listen to that conversation and document discrete data into the assessment that can go back into the EHR. So that became a very, very different paradigm for a lot of nursing staff and a lot of nursing solutions. And there was an aha moment from our customers that they realized that, you know what, that's actually solving the bigger problem. Think about it this way. Today, and this is from the American Nursing Association, right? 70% of a nurse's time is spent doing non-productive work. And of that, 41% of that is actually documentation.
Right.
So,
Right.
and 72% of that is actually a problematic because 72% of patient safety events are actually due to omissions in assessments and
Mm.
data errors in those particular nursing documentation components. So we realize that that opportunity to optimize that nursing event but then capture the documentation, that would change the game from a staffing perspective.
That is really interesting. So it's addressing some of that signal fatigue because
Yes,
taking that and pulling it into the workflow, and you're optimizing that workflow with AI to make all of those pieces sort of come together for them. And is it primarily focused on nursing, your solution, or is it broader?
it's broader actually, so we actually have found that the same usage actually applies to multiple workflow events.
Mm.
Here's a great example of this. We're starting to leverage this with organizations to actually optimize their virtual sepsis care.
Mm.
A lot of times we're seeing a lot of algorithms come out that actually allow for the ability to proactively identify a potential
Right.
sepsis. But
Predictive,
then
yeah. Yeah.
yeah, but then everybody is like, well, okay, where does it go? Who's currently on shift? Who's the care team? What do I need them to order from an order set usage perspective? So on and so forth. So we actually found that that's applicable in that collaboration model in things like sepsis care,
Mm.
in things like, for example, even remote consults. So as an example, if I needed to bring in, for example, a neurologist for a stroke consult, why not be able to leverage this AI layer to identify, oh, who's actually the appropriate clinician licensed and credentialed for this event on shift and is primary, and actually be able to pull them in on demand without having to make a bunch of phone calls because I know that my SLA is less than 5 minutes to get that clinician in for a stroke event. So we're seeing those kinds of optimizations being leveraged beyond just the nursing component.
Yeah, and I remember in our previous conversations that lends itself sort of to new care models like Uberized models and so on that you've been talking about too.
That's right. That's right. There's no secret that the shortage is pervasive across all clinical resources.
And
And
it's not going to get better in the
it,
short term.
exactly, exactly. So to your point, we are seeing an explosion of newer sort of care delivery models where we're seeing, for example, health system to health system sharing of clinical resources. We're seeing more tech-enabled service opportunities that are coming forward. To your point, there is now this ability to create an Uberization, if you will, of these clinical resources. So now a health system can, rather than staffing beyond capacity, they can staff to optimal capacity and create burst opportunities out to other networks that they may be further aligned with.
Mm. Yeah, that I think that is one of the big changes we are tracking as we work with health systems too, is just the opening of eyes and imagination to what are these new models that's possible, things that we wouldn't think about a few years ago, but now technology and solutions like yours now make possible, which is great.
Correct.
And scalability, sustainability, burnout, providing different opportunities for people who might be wanting to retire or coming back from retirement, and allows for a lot of opportunity from that standpoint.
Completely, completely. I think to your point, the creativity juices are really beginning to be stoked across the health system space. And a lot of it, I think, due to this acceleration of AI-based technology and capability. We've tried to be very specific about how we think about AI. Unfortunately, and we've talked about this before, AI is being overused, not just in our vertical, but in every industry.
Yeah.
But when you don't put that notion of generative AI in context of workflow, it loses its value very, very quickly. And so when we think about the use of AI, AI can mean a lot of different things.
Yeah.
It can mean ambient monitoring of a patient room. It can mean ambient documentation. It could mean workflow orchestration using decision tree logic and
Yeah.
forest logic based capabilities, right? How do you, when you say you use AI, what does that mean to an organization, right? What does that really mean in context? So when we thought about it, we said, let's be very specific about the types of large language models that we want to use within context of the actual event or the use case. Case in point, we look at our platform as using AI in three fundamental ways. The first is around what we call ambient observation. So we're using and injecting large language model and AI-based capabilities from Google, from Microsoft, so on and so forth, directly into cameras that would allow me to identify things like falls, elopement, suicidality, vitals. But we're also going beyond the camera. Why not be able to use things like LiDAR radar, non-camera based sensors to monitor, for example, pressure injury and movement, body movement, things of that nature. So this combination, again, it's a signal when I'm observing a patient. So patient observation is one distinct area. We think about AI as an accelerator to improving observation of patients. The second area is in workflow, right? How do we start to use the large language models and AI to identify appropriate clinical resource, this particular workflow, this distinct context, this particular set of next best actions that they need to take? So we believe that AI is going to have a relevance in how you further optimize the workflow, because the quicker that I can actually pull the right resource in, I start to impact things like length of stay, throughput, so on and so forth. The third and final area that we're using AI is in ambient documentation. It's this ability to really go beyond just creating another SOAP note or another physician note, but the ability to discreetly use that ambient documentation to update the EHR right in templates, right in flow sheets, right within the assessment itself. Because then I've taken away that additional manual step of taking out that unstructured data and trying to figure out what to do with it. So that's how we see all of that sort of coming together. Now, that requires an ability in your platform to understand when I need to use those AI-based layers and under what conditions. That is what we wanted to focus on in our platform.
That's great. That's a great overview of everything that you're doing, and it's really changing from what I'm hearing from health systems you're working with. It's really changing just the paradigm of the day-to-day for folks on the floor and broader. So my last question here is around KPIs, impact metrics. That's one thing everyone's eager to hear about. What types of examples can you share about what impact you've seen at different health systems you work with?
This is one of our favorite discussion topics because we've had the benefit of working with extremely forward-thinking health systems where they themselves wanted to actually anchor a lot of our body of work around peer-reviewed publications.
Okay.
So many of our organizations, whether it's Orlando Health or MUSC or the Hospital for Sick Children or whoever you might be working with, or we might be working with, they've actually published many of these studies in Annals of Emergency Medicine, Canadian Journal of Emergency Medicine, the ATA, so on and so forth. Some of the most notable publications that these folks have done in virtual nursing in particular, and in virtual sitting, Orlando Health actually published in the ATA Virtual Nursing Summit that the use of our virtual nursing capabilities with ambient documentation has actually saved over 3.5 hours per nurse shift per ward. That's
Okay.
pretty significant for most organizations, but an even more important statistic that they've published is that per admission, they saved over 170 clicks. We're all
Oh,
click counters when it comes to that kind
yeah,
of thing. So
yeah, yeah.
for them, that was significant and is a leading indicator of what it could do to change, if you will, the nurse to patient ratios downstream.
Right.
Now, above and beyond that, they've been able to publish in, for example, the Annals of Emergency Medicine, the use of the same platform technology to actually support and improve their ED triage or ED provider and triage workflows.
Okay.
Here, they published that they actually reduced their left without being seen by over 17%. And most importantly, that was validated by one of our other customers, MUSC, who actually did the exact same type of workflows in their EDs. And they actually saw a 70% improvement in left without being seen and over a 500% improvement in productivity for provider and triage. So quite a significant set of statistics just in terms of throughput
Yeah.
from that standpoint. The other statistic that I think is not necessarily peer reviewed, but is something that is constantly discussed and talked about at a financial level. The organizations that we work with, because they've gone to a platform play, they've been able to actually reduce their total cost of ownership quite literally down to about 60% of what they were typically paying in single purpose technologies and trying to cobble everything together. That's pretty significant for most organizations because now the cost and management of a true platform is much more effective and allows a healthcare institution to actually enter more innovative technologies right within their own ecosystem.
Oh, that's really interesting. Well, thank you for sharing all of this. This has been a great conversation. Anything else you'd want your audience here to know about, and/or anything that's coming up, or anything else on your mind to share?
Sure, sure. Well, there's a few things that I'll probably just make mention of. The first being that over the next couple of months, you're going to also see some new publications coming out
Okay.
from some of our customers that are starting to delve into things like transitional care management and remote patient monitoring, and how we're using the AI to support a lot of that. And actually, a prospective observational study that's coming out is how one of our organizations use this technology for transitional care and RPM and reduce their readmission rates by over 40%. And so now we're taking the concept, if you will, of how you manage and monitor patients from a virtual nursing standpoint beyond the inpatient setting, but now moving to the at-home setting. You can also learn a lot about this if you want to visit us at any one of the events that are coming up. For example, if you'll be at the Vizient Innovative Technology Exchange here in September, we'll be speaking at that particular exchange. We'll also be speaking in New York on October 2nd at the Con V2X conference around AI and what our customers are doing from an AI standpoint. And of course, if there's any opportunity for you to attend any of the upcoming virtual nursing summits, whether it is the ATA Virtual Nursing Summit, the Magnet Nursing Conference, or even the CNO Institute or Chime, we will actually have a presence at every one of those particular events as we get towards the end of the year. So we'll encourage you, please let us know how we can connect with you if you plan to be there.
That's fantastic, Noel, and congratulations on all the work you've done and everything that's coming up. All sounds very exciting. And
Thank
of
you.
course, Andor has a profile in Avia Marketplace. You can come check that out. There's information on how to reach Noel and his team over there as well. But thank you again for the conversation. Of
Thank you so much, Sonia. I appreciate it.
course.